Good evening, everyone. That is our top story this evening. The changes by the Centers for Disease Control and Prevention affect people who are exposed to the virus.
News 8 Now's Tyler Jobe takes a closer look at the changes and how they will relieve a burden for La-Crosse's hospitals.
The CDC says anyone who gets exposed to the coronavirus can now quarantine for up to 7 or 10 days instead of the traditional 14-day measure.
This will help people who cannot be quarantined for 14 days to be compliant with the recommendation and still prevent the virus from spreading.
If someone doesn't take a test but shows no symptoms, they can end quarantine after 10 days. People can end their quarantine after a week if they don't have symptoms and test negative.
Majority of the transmission occurs within the first 10 days.
Mayo-Clinic-Health-System infectious disease specialist Raj Pelraj thinks the new guidelines are a good idea, but still suggests people quarantine a full 2 weeks if they get exposed.
The 14-day measure is probably the safest for the community.
La-Crosse Deputy HR Director Dave Baroker says the guidelines won't change much of what the city is already doing.
As far as people coming back to work, what we're going to rely on are the medical professionals.
That means someone could be in quarantine for 7, 10, or 14 days.
When is it safe for me to go back to work, and then they'll let us know.
But there is a possibility people can start working again sooner. That will be helpful, especially for small businesses.
I think that everybody is doing what they need to do.
Pelraj says Mayo and other healthcare systems are short of staff right now, which is the last thing they can afford.
If we can reduce the quarantine period safely, the staff members can come back to work and take care of patients.
In La-Crosse, this is Tyler Jobe, News 8 Now.
There are some new risks with these new recommendations. The CDC says a 10-day quarantine can result in an up to 10% risk of transmitting the virus to someone else.
And a person who quarantines for a full week has up to a 12% chance of spreading the virus.